Hi, it's Brigetta here from the Vegan Handbook. This is October, and October is Breast Cancer Awareness Month. And today's conversation is all about knowledge, empowerment, and taking charge of your health. We're going to talk about how to do a breast self-exam and what you're looking for. We're going to talk about mammograms and other screening options, and how a plant-based lifestyle can support breast health as well as overall health and wellness. Whether you're just starting out your wellness journey or you're deep into it, this is information every woman should have in her toolkit. So let's dive in. Breast cancer awareness key facts. About 1 in 8 women in the U.S. will develop invasive breast cancer over the course of their lifetime. Our risk increase after age 50. And while Black women are diagnosed at similar rates as white women, we are often diagnosed at later stages and we have a higher mortality rate. There are many factors that we can't control, like age, genetics, family history, but there are so many powerful things that we do control. And that starts with knowing your body, nourishing it daily through lifestyle choices. So let's talk about self-examinations, knowing what is your normal. We're going to start with 5 steps. One of the most empowering habits that we can build every month is a monthly self-breast exam. For those who are still having a menstrual cycle, the best time to do this exam is after your cycle ends, when your breast tissue is less tender. And for postmenopausal women, just pick a date each month, the first of the month, payday, whatever works for you. Just pick the same date so it becomes a part of your routine. And there are 5 simple steps to guide you through a self-exam. So step number 1, you're going to take off your bra and stand in front of a mirror with your shoulders straight and your hands on your hips. You're looking at your breasts and you're looking for unusual size, shape, color changes, dimpling, puckering, or bulging of the skin, a nipple that has changed positions or become inverted, redness, soreness, rash, swelling. If you notice anything unusual, don't panic. Just make a note of what it is and then follow up with your healthcare provider immediately. Step 2, you're going to raise your arms and you're looking again in the mirror with your arms overhead. And you're checking for the same changes. Sometimes things look different at different angles. Step 3, you're going to check for fluid. So that means gently squeezing the nipple, and you're looking for any kind of discharge. It could be watery, milky, yellow, bloody. Whatever it is, you're going to report the discharge to your doctor. Step 4, you're going to do lying down on your back with a pillow under your right shoulder, and you're going to use your left hand to examine your right breast. And you're going to use the pads of your 3 fingers, and you're using a smooth circular motion. You want to cover the entire breast from the collarbone to the top of the abdomen and from the armpit to the cleavage. And you can use 3 pressures: a light pressure for the tissue closest to the skin, medium pressure for deeper tissue, and then a firm pressure for the tissue that's closest to your ribs. And then you're going to repeat on the other side with the opposite hand. Another thing to do is to stand in the shower and do that self-exam because a lot of women find that it's easier to find any kind of abnormality when they're wet, when their body is wet, and you're going to check the same areas. And the goal with the self-exams is so that you can notice any changes, anything that's different. You are the first line of awareness for your body. You can find a step-by-step guide of self-exam at breastcancer.org. So let's talk about screening, because mammograms aren't the only tool that you can use. Every woman deserves to know her options and to make informed decisions with her healthcare team. So mammograms, they are the standard, the industry standard. Mammograms are the most common screening tool. They detect tumors or calcifications early, sometimes years before you can actually feel that with a self-exam. They are widely available and typically covered by insurance, starting at ages 40. but there are a few considerations. They can be uncomfortable, a little awkward. They're not painful. There's a low radiation exposure, and for women with dense breast tissue, mammograms may miss some abnormalities. They are best for women, most women starting around age 40 to age 50, depending on risk factors. And those are according to the American Cancer Society guidelines. Then there's also an ultrasound. A breast ultrasound uses sound waves, no radiation, no compression. It's a great supplemental tool, especially for women with dense breasts. It can distinguish between solid masses and fluid-filled cysts, but it might miss small calcifications, and accuracy, it really depends on the technician. So it can also lead to more false positives. It's best for women with dense breast tissue as a follow-up after a mammogram. Then there's an MRI, magnetic resonance imaging. The MRI is the most sensitive imaging tool. It can catch cancers that mammograms and ultrasounds might miss. There's no radiation, just magnetic fields and contrast dye. It is more expensive and sometimes not covered by insurance for a woman who's of average risk. And there is a higher chance of false positives. And it does require an IV contrast injection, which not all women tolerate well. It is best for women that are at high risk with genetic mutations like BRCA, or if they have a strong family history or prior chest radiation. Then there's also thermography or thermal imaging, which measures heat patterns and blood flow. It is completely non-invasive, no radiation, no compression. Some women use it as an additional tool for monitoring any changes in their breast tissue. However, it is not approved as a standalone screening tool by major health authorities. It might miss cancer, and insurance typically does not cover it. It's best for women who want additional information, but it should never replace a mammogram or medical imaging. And really, there's just no one-size-fits-all answer. The right screening strategy depends on you, your age, breast density, family history, and your comfort level. So at this point, your job is to know your options, to ask questions, and choose what aligns with your health goals. It's important that you advocate for yourself. A whole food plant-based diet lifestyle supports breast health by delivering antioxidants and phytonutrients that fight inflammation. They provide fiber, which regulates hormones like estrogen, and reducing saturated fat and processed meats. Both are linked to increased risk of cancer. Practical ways to start this is to add a rainbow of veggies to your meals. Swap cow milk for plant milk. Try meatless Monday or Thursday or both days. I personally noticed better energy, improved digestion, and reduced inflammation when I made the shift in my own life. And I've seen women thrive when they focus on abundance and not restriction. So here's your power trio for this month. Do a self-exam, pick a day, make it a habit. Schedule your mammogram or talk with your provider about the best screening plan for you. Add more fruits, veggies, and water to your daily routine, and make sure you move around. Nourish your body from the inside out. Early detection and lifestyle choices equals empowerment. So let's lift each other up, encourage a healthy lifestyle, and celebrate these beautiful, powerful bodies that we live in. I hope this video has been helpful to you. Please give it a like and share it with your squad, and subscribe for more plant-powered wellness. And if you want more information in converting to or sustaining a plant-based lifestyle, then join the Vegan Handbook community at www.skool.com. Again, I'm Brigetta Newman from the Vegan Handbook, and as always, eat well, live well, be well. I'll see you next time.